The next disease is Zika. Zika is a mosquito-borne pathogen caused by the Zika virus. So often what happens is mosquitoes will be infected with this virus. It'll be present in their saliva. So when the mosquitoes feed off of a human host, they will inject the Zika virus into the host through the saliva. So if you become infected with the Zika virus, initially you'll experience either no symptoms, often patients are asymptomatic, to kind of mild, nonspecific signs or symptoms. So often individuals that contract Zika will get a mild fever. They might have some muscle and joint pain, possibly a headache, conjunctivitis, inflammation and reddening of the eye, and then in some cases even a red skin rash that comes up on the skin. But generally not necessarily a life-threatening condition. In some individuals, it can trigger something called Guillain-Barré syndrome. This syndrome is relatively rare, and it can happen post-infection with a variety of different pathogens. So Zika infections can contribute to it, but it has also happened post-COVID infections, influenza infections. Individuals have even gotten this after receiving a vaccine. What happens is our body produces antibodies to destroy the pathogen, but unfortunately those antibodies target peripheral nervous system tissue and can actually lead to patients going into a paralyzed state. It is usually temporary, but in some individuals it can last potentially even weeks to months at a time. So it can be quite debilitating. But infections with the Zika virus have known to trigger this condition in some individuals. So as the individuals produce the antibodies to fight off the Zika virus, it can attack the peripheral nervous system and lead to Guillain-Barré syndrome. So there have been outbreaks of Zika virus in the past in the United States, so you may be somewhat familiar with it. And this particular complication that we'll talk about next is probably what you heard about when Zika was present in the United States. So Zika is a really big concern amongst individuals who are pregnant. What can happen is if someone who is pregnant contracts the Zika virus, especially within that first trimester when fetal development is occurring, it can halt fetal development. It can actually make the baby be born with a condition called microcephaly. Not every pregnant individual that contracts the Zika virus is going to have a baby born with microcephaly, but it does increase the chance that this could happen. So what is microcephaly? It basically is a condition where babies are born with abnormally small heads, usually as a result of underdeveloped brains. It can lead to vision problems, involuntary movement, seizures, irritability, even things like learning disabilities. But this condition can result as a result of becoming infected with the Zika virus during that first trimester of pregnancy. It's passed vertically through the fetus, and then the babies can be born with this condition, microcephaly, abnormally small heads. So as far as transmission, like I said, the most common way to get Zika is through the bite of an infected mosquito. That's how most cases are acquired. With that being said, it can also be passed through sexual intercourse. So if a female has the Zika virus, becomes infected with the Zika virus, she can transmit it in vaginal secretions for up to 2 weeks. With males, they can actually transmit the Zika virus in semen for up to 6 months. So it lasts much longer and can be transmitted for much longer amongst males. It can also be passed vertically in utero. So again, it can be passed from a mother to a fetus, and that's what's particularly a concern because that can lead to microcephaly. With children and adults, if they get a Zika infection, like I said, would get something like a rash, headache, muscle soreness. It's not a debilitating or life-threatening condition, But where it becomes a big concern, obviously, is amongst pregnant women who can pass it in utero, where it could potentially lead to microcephaly. As far as prevention and treatment, currently there's no vaccine. I'm sure that will change eventually, but right now there is no vaccine. So the biggest route of prevention is to avoid getting bit by an infected mosquito. So anytime you are traveling, you should always check the CDC and see if the area that you're traveling to is known to have any types of infectious diseases that are endemic to that area. So for example, a lot of the warmer type environments throughout South America, Asia, Africa, they're all known to have Zika. So if you would travel through those areas, you'd want to be really cautious about mosquito control, wearing protective clothing, using insecticides, staying away from still water sources where mosquitoes could breed. So avoiding those types of situations would be ideal. And then obviously, to prevent sexual transmission, safe sex during intercourse would be necessary. There is unfortunately no treatment. I mean, honestly, if you're a child or an adult and you get Zika, it is self-limiting. You'll monitor signs and symptoms, but you'll likely recover without any complications. The only kind of severe complication that you have to get treated for would be something like Guillain-Barré syndrome. And unfortunately, if a pregnant woman contracts it, and it gets passed in utero, there's nothing that we can do to prevent microcephaly from happening. It's just a condition where we wait to see, once the baby was born, what kind of a supportive treatment we could provide. Okay, this map's slightly outdated. It's from 2022, but this kind of just shows us the areas where we have had Zika in the past or currently have Zika. Like I said, it is definitely the more warmer kind of tropical environments throughout South America, Asia, Africa. Now, we have had Zika in the United States. Back in 2016, there was cases of Zika reported in Florida and Texas. So there is a very good chance that this could happen again. It's not currently in the United States, but it could happen again, so it is something to be on the lookout for. So the next disease is tetanus. I think this is something that we've probably all heard about. It's a very common disease that we're concerned about within the community. Tetanus is a bacterial infection caused by a bacterium known as Clostridium tetani. Clostridium tetani is a bacteria that is commonly found in the soil. Because it is commonly found in the soil, it can also be found in the gastrointestinal tracts of animals. But the most common place that you would come in contact with it would be in soil. This bacteria is gram-positive, but more importantly, this bacteria is an anaerobic endospore former. So anaerobic means that it is not going to survive well in environments where oxygen is present. So it tends to not like oxygen. It is an endospore former, meaning when it's in harsh environments, it will form a protective layer around its genetic material to allow it to survive in harsh conditions. So with Clostridium tetani being an anaerobic bacteria, we know it doesn't like oxygen. So when it is exposed to oxygen, it is going to be in the endospore form. So right now, if Clostridium tetani is in the soil, it is going to be in its endospore form because it is subjected to oxygen, which it does not like. As long as Clostridium tetani is in the endospore form, it is dormant and cannot do anything to hurt you. Where it becomes problematic is when it gets into an anaerobic environment. When it gets into an anaerobic environment, that's the environment it likes, and that is when it can go out of its dormant endospore phase and actually activate. And when it activates, this bacteria produces very dangerous toxins that are released into the host that it infects. So as far as transmission, the most common way to get tetanus is through the endospores getting into a puncture wound. So if you get a puncture wound, that is going to damage tissue at the puncture site, which means at the wound site, there is going to be a low oxygen supply from the damaged tissue. So that creates this kind of anaerobic environment. So if the Clostridium tetani endospores get into the puncture wound, which is now this temporary kind of anaerobic environment, that's a good environment for them. So what they're going to do is they are going to activate in that puncture wound. And when they activate, these bacteria produce a very potent neurotoxin, which is a toxin that affects the nervous system. So if we remember from a previous lesson, neurotoxins affect the nervous system. The nervous system controls the muscular system, so we're going to have some type of impact to the muscles here. So when Clostridium tetani endospores are placed into that anaerobic environment in that puncture wound, and they activate to release the neurotoxin, the specific neurotoxin that they're creating is a toxin called the tetanospasmin toxin. The tetanospasmin toxin is a toxin that is going to cause very violent muscle spasms throughout the body. You may have heard of tetanus getting called lockjaw. The reason why it was called lockjaw is because individuals that became infected with the tetanospasmin toxin would get violent muscle spasms in their jaw, causing it essentially to lock shut. But these muscle spasms would happen throughout the body. You would have hyperflexation of the arms and legs, arching of the back. And it's important to note, these are not just minor little twitches. These are extensive and very strong muscle spasms that could potentially break bones. So these are very, very, very violent muscle spasms. So prevention and treatment, this is a disease that is very much preventable. So we do get a vaccine to prevent us from getting tetanus when we're young children. When you're a child, you get a vaccine called DTaP, and that vaccine protects you from diphtheria, tetanus, and pertussis, the other diseases we'll talk about later on. And it typically provides immunity for about 20 years or so, sometimes longer in some individuals. But usually by the time you get to your 20s, you would want to get your titers checked to make sure you're still immune. If you're not, then you're going to get a booster shot called Tdap. And Tdap typically provides protection for 10 years. So it is something that you have to keep up on every 10 years. And a lot of individuals don't remember the last time they were vaccinated, and they don't know if they still have any immunity. So kind of a golden rule is, if you ever get a puncture wound by something that you feel could have been contaminated with soil, go to the doctor, urgent care, or wherever, and get your tetanus shot. When you go to the doctor, you can prevent tetanus from progressing to the point of signs and symptoms. So it is very important, if you ever get a puncture wound and you feel that the puncture wound was contaminated with, the thing that caused the puncture wound was contaminated with soil, you would go to the doctor and get those injections right away. So if you do get a puncture wound and you go to the hospital, they are going to give you a Tdap shot. So they are going to give you the vaccine to boost your immunity. That's kind of step one. But then they're also going to give you an antitoxin injection. It's basically antibodies that are going to bind to the tetanospasmin toxin if it's present and neutralize it. And then once the toxin's neutralized, that's going to prevent the muscle spasms from even happening. Or if you're already to the point where the muscle spasms are happening, it'll stop the muscle spasms. It's essentially the same thing as like getting an antivenom if you've been bit by a snake. But the antitoxin is just going to neutralize the toxin and either stop it from progressing if you made it before signs and symptoms, or stop the spasms if you're there post signs and symptoms.